Assalamu alaikum. I'm Dr. Sultan Badar Munir. I'm going to present a case of stridor and hoarseness of voice since birth in a 2 years old child. On examination, the stridor was inspiratory. Its laryngotracheobronchoscopy was planned and anesthesia fitness was taken and routine investigations were done. On LTB examination, the epiglottis was omega-shaped and there was subglottic stenosis. The subglottic stenosis was of grade 3. Rest of the airway was normal. It was immediately planned to go for tracheostomy. Further management will be discussed later. Thank you very much.